that I would never recommend giving a human product to your pet without checking with your veterinarian first.
You know, it's not uncommon for pet parents to give pets human medications, like Benadryl, for example. But if that dose is too high or the pet accidentally gets into it themselves, it can lead to not only a trip to the veterinary emergency room, but potentially it could be fatal to that pet. And today I wanted to share a cautionary tale about an incident that happened with a lab mix. Her name was Luna, after she got into some human allergy medication. And we're going to speak with Dr. Renee Schmid, a board-certified veterinary toxicologist and director of veterinary medicine at the Pet Poison Helpline. And she's going to help us learn what we need to know about pets and human medications, and also how the Pet Poison Helpline can help us if we ever need it. Hopefully we don't. What's up, pet lovers? I'm Kristen Levine, founder of Pet Living, where I connect you with incredible pet experts so that we can all learn how to be the best pet parents ever and how to live happier, healthier lives with our best friends. And then I'm going to bring up Dr. Schmid. Welcome.
Hi, thank you for having me.
Oh, it is a pleasure to have you, and thanks for your time today. You are a senior veterinary toxicologist at the Pet Poison Helpline. What does a veterinary toxicologist do?
We're a veterinarian who specializes in really anything that could potentially poison an animal. And so we devote our career to learning about the mechanisms and the potential signs and outcomes and treatments that are necessary for an animal of any species that could get into something that could harm them.
Yeah, and speaking of that, let's tell Luna's story. So Luna is a lab mix from New Mexico, and her mom, Tiffany, was a traveling nurse. Or is a traveling nurse, and she had just gotten home from a really long trip and she had Luna in the car with her, and she needed to run into the store real quick, and she thought, you know what, Luna and I've been driving all day, she's not going to get into any trouble. So she runs into the store, she's in there for just a few minutes, comes back out, and turns out Luna had gotten into her purse, and in her purse was a bottle of Benadryl. Is that right?
Yeah, that's right. Yeah, it had about, in a new bottle, it had 125 milligrams tablets of Benadryl. This bottle had been opened before, so the owner, Tiffany, wasn't quite sure how many were still in there, but knew that there were quite a few. And unfortunately, this is not an uncommon scenario for pets to get into the owner's bag or purse or that car cup of gum when they run into the bank or the store for just a minute and come out and can have really some devastating consequences.
From what I understand, she got Luna home and Luna started presenting with some symptoms. What were some of those symptoms that she was showing?
Luna became ataxic, meaning she had a difficult time walking. She became very agitated and restless. She also started vocalizing, which was not normal for her. Her pupils became enlarged, or it's called mydriasis, so enlarged pupils, and she just neurologically wasn't acting herself.
And fortunately, Tiffany, I believe she called the Pet Poison Helpline. Is that right?
Yes, ma'am.
And we're going to talk about that in a bit because that's a really important piece of the story. And I believe the veterinarian at the Pet Poison Helpline told her to get to the emergency vet as quickly as possible. And then that veterinarian worked with the vet at the emergency hospital to get Luna out of trouble. Is that right?
Yeah, you got it. So one of the key things that we do, and it's what we've devoted our career to, is to talk with pet parents to find out what it is that their pet got into. Is it going to be a problem? Obviously, we knew that Luna was already showing signs and issues with that, but to what extent would we be concerned? And was it something that she definitely needed to be seen, or did we think her signs would go away on their own and she could be monitored at home? And unfortunately, as you mentioned in Luna's case, she did need to go into the veterinarian. And then when Luna was at the veterinarian, their veterinarian called us, and then they were able to talk with our veterinarians and our specialists in toxicology to find out what it is that we were concerned with and what type of treatment Luna was going to need.
Ultimately, Luna did recover from that episode, but this could have been fatal, couldn't it?
Absolutely. And a lot of times Benadryl is given to pets, and a lot of veterinarians will prescribe it and send it home for their pets for maybe some mild allergies that they might have, or maybe they were stung by an insect or bit by an insect and was having an allergic reaction to it. And so Benadryl is certainly something that can be given to pets, but the amount is really the key here. And for Luna, unfortunately, she wasn't given an amount that was normal for her size. She had a heyday and helped herself to a bottle of Benadryl. That was really what caused the large amount of issues to occur.
Because like you said, veterinarians do often give pets Benadryl or they recommend it, but I think that we as humans that take Benadryl ourselves don't necessarily think about how important that dosage is.
Yeah, you're right. And it's a really important difference between human medicine and veterinary medicine, because for us as humans, a lot of times your doctor will say, well, as an adult, take 500 milligrams of this or 20 milligrams of this. But for a pet, as you can imagine, even with our dogs, they are so different in size that one size doesn't fit all. And so we actually have to dose them much more carefully based on their specific weight, as opposed to whether or not they're a grown adult or they're a young puppy or kitten. And so that's where a lot of that difference comes into play, where you and I might say, I'm just going to take a Benadryl. I'm showing how I'm having some allergies and I'll take that and everything will be fine. But with our pets, giving that same amount could be really problematic. And it's really something that I would never recommend giving a human product to your pet without checking with your veterinarian first and finding out from them, one, is it safe? Can I do that? And two, how much should I give? Always remembering that pets are not small children and pets are not babies. And so their dosing, even though it's an infant medication, sometimes our pet parents are, with the best of intentions, will think, oh, well, it's okay to give to my baby. It's got to be safe to give to my dog. They're kind of about the same size. And that can be really could have some fatal consequences.
What percentage of the calls that you get at the Pet Poison Helpline have to do with pets either getting into human medication or being given human medication by their pet parents?
Yeah, it's a great question. Human medications make up about a third of our calls. And so they were either, like you said, they either were given them incorrectly or they were just got into it because maybe the owner left them out. Humans are humans. Even the most well-intentioned pet owner, the most cautious pet owner can slip their mind just a minute and leave something out that their pet can then get into.
What are some of the other human medications that you get calls about?
So probably the most common human medication we get a call about is ibuprofen. And if you think about the availability of ibuprofen, it's in a lot of households. And so it's something that an animal may get into. Again, I have a bottle of ibuprofen in my purse, I have a bottle in my car, and I have a bottle in the bathroom. And so, there's different opportunities where they could maybe get into that. Also, again, that well-intentioned pet owner, they may find that their dog's limping and it's Saturday night. Their veterinarian doesn't open until Monday and they want to provide some relief for them. And so they give them ibuprofen on their own and then find that actually what they gave them was something that shouldn't have been given or a large amount that was going to be unsafe for them. Some of the other medications that we will get calls on would be even just supplements. So like vitamin D3 supplements, or maybe some other types of like an iron supplement, or medications for either infants or children, and heart medication. We also get calls where the pet parent has their medication and their pet's medication right next to each other, and then they mistakenly gave their pet the human medication instead of the pet's medication. And so I always recommend keeping them in completely separate areas so that so they don't make that mistake.
Tell us how it works.
We're a 24/7 animal poison control center, and so Pet Poison Helpline never closes. We're always open. So if your veterinarian is away or it's after hours or a holiday and you're needing advice, you can always call and we can help with that. And so that pet parent will call into our facility, and those calls are answered by our veterinary technicians. And these are technicians who have had a lot of training out in the real world. So they've had a lot of practice in the clinics, and then they've had special training in toxicology. And so they're going to get a lot of information from you. And so you might be stressed and worried and You don't want to be asked a lot of questions, but I assure you those questions are going to help us make the right assessment for your pet to decide, is this problematic? Is this not problematic? And then what needs to be done if it is going to be a problem. And then from then, if we need to send you into the veterinarian, or even if not, you get a reference number so that you can always call back. You can call back regarding that same case for no additional fee as often as you need to. And then if the veterinarian is needing to call us, so if you need to take the pet to the veterinarian, they can call us and we will just pick up where you and that veterinary technician left off. So we'll talk about what our main concerns are, what the treatment needs are going to be, and then that veterinarian can call us back again as often as they need to.
There are a couple of different ways you can work with the Pet Poison Helpline. There is a per incident fee, but from what I understand recently, you've rolled out some subscription services.
Yeah, we did. So we also have a nurse line, which is just general information. My pet's not feeling well, or my doctor just recommended having a certain surgery done, and I'd like more information on that. And that's called Pet Helpline. And with that, that's a subscription-based service. And you can have two options. One is you can do a subscription-based for just general medical information, and that's 24/7 as well. Or you can also do the subscription service that includes Pet Poison Helpline's assistance.